Hi, my name is Dr. Walter Crooks, and I want to start off by saying that vertigo, dizziness, and balance disorders are not just a problem with the inner ear. I know you've probably been told it's your inner ear, and there's a chance it is. However, there's a great possibility that the problem is located somewhere else. We'll start by discussing the cerebellum. It's located here at the base of your brain. Some of the processes our cerebellum is involved in include the initiation of movement. It coordinates our thought processes, coordinates movement, and controls our balance. Secondly, the cerebellum is intimately related to the vestibular apparatus. Now that's what most people are talking about when they say inner ear. There's a condition that is associated with the area is known as Bppv, Benign Paradoxical Positional Vertigo. Now in this inner ear area, we have three semicircular canals that are filled with endolymph. It's like a fluid that's sitting in there. So whenever your head moves, that fluid moves and it lets your brain and your cerebellum know where your head is so you can coordinate where you are in space. Well, people that have problems with their cerebellum, with that endolymph, whenever they turn their head, whoa, they get dizzy like that. Now, a third part of the system that we're going to talk about is your proprioceptive system. Now, that's a part of the system that lets you know where you are in space, lets you know where your feet are on the ground. If you don't know where you are, where your pieces are at, you can slip and fall, twist your ankle, and get hurt. Now in medicine, the only drug that I know that they use for this is meclizine, and that's just for the inner ear. There is no other drug for the cerebellum or the proprioceptive system. The reason I'm going over all this is because when you come into the clinic, we're going to have to do an extensive and comprehensive neurological examination. Let me explain. I'm a chiropractic clinical neurologist. Now, just like in medicine, chiropractic has subspecialties. General practice chiropractors focus mainly on neck and back pain. Chiropractic neurologists focus on the aspect of the brain, spinal cord, and nervous system to improve overall function of that system. So here are a few tests that you can do to see if you have some cerebellar problems. First thing you can do is you can take your shoes off, have your spouse with you, stand by your bed, but don't be touching it. Put your feet totally together, heels and toes, arms to your side, and close your eyes. If you fall back or forward or sideways, we're thinking about a cerebellum problem there. Next test you can do, same position, touching nothing, feet together, hands out in front of you, pinky fingers, close your eyes, and slowly touch the tip of your nose with your finger. If you miss totally, that could either be cerebellum or your proprioceptive system. If you get breakdown like this, we think cerebellum. If you shake when you get to the end, cerebellum. Another test that you can do is you can take one hand, put another hand in it like this, be around your waist, and alternate movements like this. It should be smooth like that. If you start to break down to where you're hitting the same side over and over, cerebellum. Now that's the neurological portion. We also want to talk about the metabolic portion that we'd have to go over. See, nerve cells need two things to thrive and survive. There's fuel and activation. Now fuel we get from the air that we breathe and the food that we eat. We convert it to glucose. Activation is the movement and the sensory information that we get. We'd want to test your metabolic system to make sure you're getting the correct fuel to your system. So we do blood work to make sure you're not anemic or other things, to make sure you're getting the correct oxygen and glucose to your system. We'd also do food protein testing to see if you're having a reaction to some of the foods that you're eating. Because if that happens, you have inflammation in your whole system, the brain, spinal cord, cerebellum become inflamed, and now you can't function properly, and we get the dizziness. You see, we leave no stone unturned at Life Changing Care and Neurology Center. We will do whatever it takes to get to the root of your problem so we can find out finally what's going on with you. I've enjoyed spending these last few minutes talking to you. Thanks for spending your time with me.